This is a demonstration of an application I built comprised of several underlying forecasting and simulation models to assess drug demand and insights pertaining to overdoses, overall overdose rates, overdoses from fentanyl, opioid usage, and the drug epidemic in the United States. The data that was used here was a combination of CDC Wonder, SAMHSA, NSDUH, DEA, a confluence of data sources that was constructed to do this analysis and build this application. So right off the bat, we can see the different types of metrics such as overdose death rates, illicit drugs, and opioid prevalence by years. And then this is just a geographic representation of what that looks like to get a sense of where the country is by states. So for example, we could see West Virginia has a high overdose death rate, right? We could see that Arizona has a relatively high death rate, Kentucky, et cetera. And then we could look at illicit drug prevalence and opioid prevalence as well. Moving on, we can also forecast nationally or by any state what the overdose rate, drug prevalence, and opioid prevalence would be forecasted to be going forward to 2030, right? So in this example, I'm going to look at the national indicators, and I'm going to just look at like the overall overdose rate per state. And then I've selected the various forecasting models: ARIMA, ETS, Holt, Winters, TBATS, Profits, XGBoost, neural nets, etc. And then I run the forecast, and I could use a time series or state pooled. I'm going to use the state pooled forecast to get a larger sample size at the state level. And then you could see down here, it's running the forecasting application. And as it runs it, you will see in the application that it shows the historical indicators here, the historical trends on what the overdose rate is in this case, and then what the forecasted overdose is based on the confluence of these models. And then here you can see the different type of model performance. And then the model that has the lower RMSC and MA and MAPE is the higher performing model. And then you can see it's neural net, and it shows the different types of models. But we want to look at the neural net model, right, which is this one right here, right? So you have a slightly decreasing but flat forecast of overdose rate, which is hovering right below 80 nationally. And then so we can then run regression analysis. And in this regression analysis, these are the external regressors that we test. And then so we could look at the poverty rate, unemployment, mental health prevalence, ACE prevalence, treatment gap, median income, household debt, uninsured rate, and healthcare access. And we generate the forecast, and then you could see that it shows the AirMax forecast. And it's similar to the overdose rate as the ensemble forecast here, fairly flat, just hovering in this case slightly above 80. But this is just a directional forecast. What's more interesting is the regression analysis that shows the factor impact of these various factors, determinants, social determinants of health pertaining to drug overdoses. And you could see one thing that sticks out here is household debt. And you could see household debt is just significantly higher than the other factors. And household debt is an indicator for chronic stress exposure, financial despair, and the studies validate that substance use is a coping mechanism associated with a high degree of a household debt. And the significant regressors here, the results show that it's mental health, adolescent childhood, trauma, median income, household debt, and the uninsured rate. So we could go really far into this application. This is just an overview of this application. We could run scenario levers, but by seeing what happens if we increase the education rate, right? So let's say we increase the education rate, unemployment rate goes down, treatment capacity increases, what would happen to reducing the number of overdoses. Um, and you could run various other scenarios like this as well. We also have what's called the agent-based model. And what an agent-based model does is it simulates the population dynamics or individual behaviors. And in this case, we simulate this to understand individual behaviors and the intervention effects on the population level outcomes over time. So you could see here, we could set the population size. So let's say I want to look at a population size of 20,000 people, and then we want to look at a duration year of, let's say, 5 years, and the percentage of initial users. And then we want to look at like what the treatment capacity is or naloxone coverage. And then so let's say we set naloxone coverage where it's available to 25% of the population. We run the simulation and then it shows what happens over time in terms of like the number of people that have access versus active users, the compartment flow, right? Looking at the those that are recovered in treatment, active users, those that are susceptible. And then we could run various other levers to see what would happen in terms of lives saved. We also built a policy impact analysis simulation tool whereby we could test the different types of intervention strategies to see what the impact of those strategies are, right? So in this example, you could see here, these are all the intervention types of intervention. So let's select MAT, mood, naloxone, PDMP enhancement, safe consumption, school-based prevention, law enforcement, economic development, drug courts, and so on. And then we run the analysis. And then the analysis, you could see, shows that it shows the number of lives without intervention, and then the number of lives saved with intervention. And then here it shows if you incorporate all these types of interventions according to the simulation, you could save 151,000 lives that you would not otherwise be able to save. And then here it shows the interactive effects of those interventions to show which ones are more significant than other types of interventions when we take into account the totality of lives saved. So we could see 50% of the lives saved are attributed to MAT mood, MOUD expansion, followed by naloxone distribution, safe consumption sites, mental health integration, peer recovery support, and drug courts. And at the bottom, it shows that law enforcement, the supply side effects of it, has about a 5% impact. So it does have an impact, but this right here kind of validates or reinforces the confluence of literature that shows that the reduction in overdoses and usage should be focused on demand-driven interventions, and that law enforcement, though necessary, the supply side interventions actually have a very low level of impact in terms of intervention effects. And then below here, it shows the impact distribution. So if you incorporate all these types of interventions, which states would be most affected in terms of the positive impact of an intervention. And it shows California, Florida, New York, Ohio, Pennsylvania, and Texas. And at the bottom, you see Indiana, Massachusetts, Maryland. There's probably some correlation in terms of population size here, but this shows the distribution of population size. And then we could even go down into looking at budget allocation and projected outcomes. But there's a lot to this application. This is just an overview of the different types of ways that you could use this type of application to forecast what the direction is in terms of different types of variables pertaining to drug demand. And more importantly than the forecast, running scenarios and experimenting with the levers to see how you can achieve the best policy outcomes in preventing or reducing drug use, illegal drug usage, and overdose. This concludes the demonstration.